Today our main speaker is Dr. Vander Ley, Veterinary Epidemiologist at the Great Plains Veterinary Education Center in Clay Center, Nebraska. Dr. Vander Ley's primary profession interest is to enhance beef cattle production sustainability by improving animal health and performance at all levels of production. His research is focused on bovine respiratory disease, developmental programming, and preventative health measures in beef cattle. Thanks for joining us today, Dr. Vander Ley.
Excellent. So I'm going to talk today, the main topic is we're going to talk about remote drug delivery devices, or dart guns. There's quite a bit to get through on this one in terms of things to think about relative to dart guns. But before we do that, I'd really like to have you guys share with me some thoughts. So we're going to use an audience participation system today. If you're using your phone, this might be a little bit challenging to do, but there's a system out there called Slido, and what I'd like you to do is go to either slido.com or just Google Slido, and it's going to ask you for a code. And what I'd like you to do is just enter DART in there. And what this system is going to allow us to do today is it allows you to ask questions if you want to. You can use the chat box or just log in and or unmute and interrupt if you want to, but you're welcome to ask also via the Q&A that's in this platform, but also it gives me a chance to ask you a few questions, and we'll be able to look at the results of the group today. So I'm giving you just a couple of seconds here to get there if you can. If you have a different device other than your computer, you can access it while you listen. I'd sure appreciate it if you did that. So we're actually going to do a practice question first. This is one way that I can figure out how many people are participating right now. So if you can just log in, there should be a question there right now that says, where do you live? So if you've managed to log in, looks like we got a few people going. I'll leave that there for just a minute. So if you want to express your opinion, it'd definitely be good to get on, because I'm going to ask you a couple of questions here in just a minute about dart gun use and things like that in your own operation. So just so you know, unless you type your name in, all these are anonymous, so we'll never be able to track them back to you. There's no penalty for being honest. All right, so we've got 43 participants and 18 people have participated so far. So please, like I said, participate if you can. Again, along the side there, you can see how to join in. So slido.com, or you can Google Slido and just enter the code DART. So, all right, let's see how this goes. So here's my first question for you is, do you use a dart gun in cattle that you care for? And these are live, unfiltered results. Looks like most people, about 2/3, are saying no. About 1/3 are saying yes. A little bit more than that. All right, so the next question is probably not going to be pertinent to those who said no. But if you do use a dart gun, what diseases and problems do you tend to use that dart gun for? I see a couple of my favorites in there. Please note sarcasm. Pink eye and foot rot are terrible diseases. They're really hard to handle. Looks like foot rot, pink eye, respiratory disease. Cool. And one more, just in one word, if you treat cattle with a dart gun, tell me why you like doing it that way. Whether you know it or not, you're contributing to the presentation right now too. So. Logistics, it's easy. Excellent. Well, thank you all for participating. I'm going to move on and we're going to talk about today's agenda a little bit, and then I'll launch into some of the topics we're going to cover. So the first question you've already started to participate in the answer to is, why do we use dart guns? What value do they have in our systems, and common things that come up when, and a lot of this I'm bringing from my own experience relative to handling cattle and the discussions I've had with other people. I want to talk a little bit today about how we define a successful treatment. So the types of things that are going to be involved in a treatment that are going to make sure that we do the best job possible. And then you're not going to get a commercial for dart gun use today, but what I'd really like to provide you with today is some information about how things relative to darts can go wrong, and what you might be able to do to compensate for those if dart guns are a preferred method of treatment in your system. So we're going to talk a little bit about limitations, and we're also going to talk about some significant liabilities that come with using dart guns, especially for treatment in cattle. And then I'm going to go through just a few considerations. I'm not a best management practices kind of guy, in that I'm not going to tell you the one best way to do things, but I think if you're going to use technology like dart guns and darts, that there's certainly things that need to be considered if you're going to use them, and there's some real challenges that are out there. So let's start with why dart guns. You guys have pretty much hit it already with the answers to your questions. Convenience is a huge issue. We've got very, very busy people in our production systems that have more work to do than they can typically get done anyway. And disease usually ends up being a, it's not unexpected outcome, but it's an outcome that we don't maybe bank enough time for. And it just is easier and quicker to go out there and use a dart gun to treat an animal quickly and be on our way again without having to drive them to a handling facility, restrain them, and go through the time of that process. There's also some good cases to be made for stress reduction. That process of taking an animal to a chute and restraining it is not stress-free, either for the animal or for the handler. And certainly on the animal's behalf, we put a lot of effort in lots of other places to handling stress, and this is clearly a way that people see as another opportunity to reduce the stress of handling animals. Sometimes it's a welfare issue. If we have a lame animal that's miles from a handling facility, a chute, it may not be in the best interest of that animal to trail it all the way back to a chute in order to be able to treat it, and dart guns offer us simple solution for that problem. Sometimes it's labor efficiency, which kind of goes with the convenience deal. And I've heard a lot of people talk about it in terms of safety. It's difficult and dangerous to handle. Somebody mentioned bulls. It's a great example. And if we can stand off a few yards and deliver a dose of medication with a dart, that probably is better for all the parties involved in terms of safety. But I think there's certainly reasonable justification for using dart guns in some cases. But with that being said, I think it's important to consider what we really want a treatment to do. So I've got a little paragraph here, which is not a great PowerPoint presentation style, but I think there's a few points in here, and I've tried to bold those just to make them stand out a bit. But what we're really talking about for the most part here is antibiotic treatments. Most people that are using dart guns in cattle are using antibiotics to treat issues like foot rot, BRD, and pink eye. So what we're trying to accomplish with a successful antibiotic treatment is we're going to use a drug that's known to be effective against a condition that we've diagnosed in that animal. We're going to provide that drug at an effective dose via a route that we know is going to provide sufficient drug levels at the site of infection to control that particular, in this case, it's going to be a bacteria, over a known time. So we want those drug levels to last long enough to make a difference, or we need to know when to put the next dose in to make sure that we've got adequate coverage without generating adverse effects for the animal or potential adverse effects for people that are going to consume meat from that animal in the future. So we want to avoid lasting residues of those drugs in the meat products that affect human health. And we're going to talk about not only is it residues, but also adulteration of the the carcass with pieces or complete darts. So here's I'm going to go through a few limitations that are important when you think about using dart guns for treating animals. So the first limitation, and several of you mentioned that you are treating foot rots with these things. So this year, unfortunately, we don't have the benefit of quite as much grass as what old number 7 is standing in right there. But if number 7 is lame and I treat her with a dart, and I don't have the cool tools that Dr. McCoy from Star Trek has to scan from a distance, I actually am not real confident that number 7 has foot rot. And I can tell you from a lot of experience and a lot of picking up feet for various reasons that animals that I thought were foot rot frequently are not. A good example is there's a foot right there in the picture that animal was significantly lame, and when we actually did a good job of examining her foot, you'll see significant bruising right there down on her toe. So she was in pain, but she definitely does not have foot rot. And that issue, the issue with providing antibiotics is that if I treated her with an antibiotic at that point, I would have not gotten any kind of a response from that because she didn't actually have the disease I was trying to treat. So the big issue here is distance diagnostics. How much can we know about animals we're treating if we don't actually get to handle them? I think the case can certainly be made that in some instances, like pink eye, it can be far simpler to make a diagnosis of pink eye without actually having to handle the animal. But when you're talking about diseases like foot rot or even things like respiratory disease, it's far more difficult to make that diagnosis with, without getting hands-on. And the drawback to doing distance diagnostics and being wrong might not seem terribly serious. It might not seem like if an animal doesn't get better after being treated with a dart for foot rot, that's that bad. Maybe you wasted the medication, which can be very expensive. But I think it's important to think about two other consequences. One is that if it's something else and you're not treating it appropriately, most diseases never get better with time, or most diseases of the foot tend to get worse with time. So if it actually is a sole ulcer or a heel, or a wall crack or something like that, prompt attention is probably advantageous. And second is that there's consequences to using drugs, and we need to be very careful about how we use those drugs to make sure they continue to work in our systems. Antibiotic efficacy won't last forever. The second limitation with darts that I found, I've seen this in practice, seen it actually happen in front of me, but there's actually been some interesting research to document this, is that accuracy is a problem. So I put IC injections there. That's the new route called intra-cow, and it's not real great in terms of the efficacy of treatment for the animal. So delivering darts in the BQA triangle would be the ideal. There's quite a bit of discussion to talk about tissue damage associated with dart impact and the relatively violent injection that's associated with darts. And we'll cover that just a little bit later. But ideally, we don't want to break the rules of injections just because we're using a dart. In fact, the FDA has taken a pretty strong stance on convenience not being an acceptable reason for us to use a different route of delivery for drugs. A good example that a lot of people are familiar with that is that it's actually unacceptable to do sub-Q or IM injections of Banamine instead of an IV injection because it's more convenient. The FDA actually spoke to that directly. So if a drug label calls for a certain type of injection route, it's not acceptable for convenience purposes to do it differently. And by doing it differently, there's significant problems that you can incur. So there was a paper published by Dr. Coetzee and his group. I think this happened when he was still at Iowa State. He's at K-State now, but they looked at dart accuracy and published the results in the Journal of Animal Science. They actually looked at a lot of things relative to darts, and we'll talk about several of those aspects during this presentation. And then there was another study that was published by Rivera and colleagues at the Mississippi State University that was basically a repeat of the one that Dr. Coetzee did. And what Dr. Coetzee found is that when they stood back and fired darts or delivered those darts from 30 feet, 5 of the 15 actually did not enter the triangle. So that picture on the right-hand side of your screen, actually, the numbers show the placement of those darts in the triangle. So you can see there were 5 darts. One of them hit very high, and most likely that injection was made into the big ligament that supports the head of a calf. So it's connected directly from the back of that calf's skull down to its near its shoulders. And the problem with putting drug into that ligament, the reason that's not in the VQA triangle, is that there's almost no blood supply to a ligament like that, and it's going to definitely change how the drugs is absorbed from the animal, and it will probably change the efficacy of that treatment. The other 4 injections, 2, 6, 7, and 10, are all reasonably likely to have hit the animal in the jugular vein, which also can present some problems with direct consequences to health. So some of these drugs are not actually made to go IV, and they can create problems, including the death of the animal if they go IV. At a minimum, drugs that go IV that should have gone sub-Q are not going to have the same effect, the same levels in the calf that they would if they had been given according to the correct route. The other problem is that giving injections outside of the label, which usually is going to be sub-Q or IM, whatever it says, changes the withdrawal on those drugs. And sometimes it's really difficult to anticipate how it's going to change withdrawals, which can lead to problems in terms of violative residues at slaughter. So Rivera demonstrated that they could do a little bit better when they reduced the distance from 30 feet down to 15 to 25. They fired their darts from a variety of distances. But I think what's really important to note about both of these studies is that these animals were either restrained in a chute with their necks stretched by a halter, so they were actually restrained in such a way that the triangle was very available, or they were restrained just by a halter, but they were tied. They were standing still. I think a picture is worth 1,000 words, and Jesse Fulton, who we're going to hear from a little bit later, sent me this one. That is a great example of somebody that was actually really close to being very accurate, but didn't quite get the job done. That, to my knowledge, is a real picture of someone that tried to dart a calf and got him an ear tag instead. The problem is that very few of the animals that we handle are actually going to, if we went to the trouble of putting them in a chute and stretching their neck, it's probably not that useful to use a dart gun anymore at that point. And a lot of animals, most animals are moving. And the question is what this was actually presented to me right before the presentation by someone who knew I was going to do this, is what's the appropriate lead for an animal that's moving 20 miles an hour when aiming the dart from a pickup that's going 25 and they're quartering away. So those are issues that need to be considered when using darts as a therapeutic option. So a third, and probably this is one of the most concerning to me in terms of how well these things work, is that darts don't always operate the way we expect them to. So darts have been shown to fail to inject the drug on impact. And the way they figured this out, both studies actually looked at this problem. They would collect the darts and they would weigh them with the drug in, and then they would launch them at the animal, and they would pick them up once they fell out, and they would weigh them again. And darts that weighed the same when they filled them as they did when they picked them up were considered to not have injected the product into the animal. And in this case, Dr. Coetzee and his group that found that 4 of 15 darts failed to inject the animal, and Rivera and that group found that 3 of 15 failed to inject. In both cases, the problem was associated with using an air, like a pump style dart gun. The Rivera group also used CO2 powered projectors that didn't have any problems with delivering the drug, but they create some issues otherwise. So one of the things that's associated with the reasons people use darts is they're convenient, they reduce the stress, but that needs to be balanced against the fact that up to maybe 20%, 30% of the darts that you send toward an animal are not actually going to deliver the drug that you think is necessary to restore health in that creature. So there's also some important liabilities associated with using darts. Adulteration of meat is probably one of the most important. Like I said before, when we change the route, we change sometimes the amount of drug that's delivered. So the dart gun or the darts come in increments, and not every time does an animal require the full increment, but in order to get them to work the way they're supposed to, the darts need to be full, which presents another problem if you dilute the drug with something else to make sure that the dart is full. There's issues with foreign body contamination. I'm not going to show the picture today because it's not something I'm really excited to get out into the popular press, but there are pictures, or there's instances where darts have been found embedded in carcasses at slaughter. And that's a big issue. Another thing with drug residues that I forgot to mention when I talked about diagnosis, and it's a problem whether you're doing dart guns or just treating, but it's estimating weight. So when we estimate weight, the dose we come up with is only as good as our ability to correctly estimate weight, and using a scale is by far the best way to do that. My eyeball scales don't work that well, and based on some practice or some trials with other people, I don't think anybody's eyeball scales are as good as they think they are, and we can end up with significant problems with residues if we overdose drugs based on estimating the weight too high. But we can also end up with problems with efficacy if we underdose and don't give enough of the drug to get the desired effect. So that's not unique to darts, like I said, but it's a problem with darts because we're introducing new variables into the equation as well, and we're still depending on a visual estimate of weight because we're not going to handle the animal even if we have a shoot with a scale. One major liability to the users of darts is safety. So accidental injection is a real problem. Most of the darts are they're discharged by a secondary charge that goes off on impact and actually provides the energy necessary to propel the liquid into the animal. If that happens accidentally to the user, they can get a significant dose of whatever drug is being injected very quickly. And I actually found a study from the 90s where they were using darts to inject Micotil. So I said I'm not a best management practices guy, but I will tell you, you should never, ever, ever, never, ever put Micotil in a dart. It is a lethal drug. There are several others that are important too, but Micotil will kill people, and it should never go in a dart because of the risk of accidental injection. And another problem that's associated with darts, it's a liability that I don't think we spend enough time talking about, is the environmental hazard that's associated with darts that fall on animals and are not picked up. I've heard stories about some operations that rely heavily on darts that end up with a tremendous number of these things floating around. The components of darts are essentially aluminum and stainless steel and plastic. Those are not going to degrade quickly over time, and they do present hazards, puncture hazards for people, for animals, tires, what have you. And it's something that presents some concern as they build up in the environment over time. So some considerations to think about. I think it's important, and we're going to have a bit more of a BQA discussion here in just a little bit, but it's important to point out that BQA doesn't make any room for the use of dart guns. They released a statement a while ago that talks about the concerns that BQA has with the use of dart guns, and you can see the entire thing if you follow that link there, or you can just Google BQA and dart guns, and you'll be able to find the press release that talks about the concerns. And a lot of them are the ones that I just outlined. There's a lot of issues with getting the drug in the right place, making sure we're using the right amount of drug, making sure we have an appropriate diagnosis and things like that. So right now there's no room in BQA for dart gun use, and they consider it inappropriate way to treat cattle. If you're going to use dart guns, I think there's some things you really need to think about. And like I said, I can't make an absolute case against them. There are times in my career when I've used them, and we felt like we were justified in doing that. And I know a lot of people that use them and probably have good reasons for it. So I can't say that it's never appropriate. But if you're going to do it, I think there are some things you need to think about. One is I think you need to be confident in the diagnosis. And if you're not, it might be worthwhile to think about bringing that animal into a working facility where you can actually either do a physical exam or get a veterinarian to do one for you and provide an accurate diagnosis to make sure you're treating the right things. Second thing is a weight estimate. Like I said, this is not necessarily just a problem with darts. I think it's a common problem, and many times there's not great options, but we have to recognize that we have to balance the risk of underdosing and not effectively treating the problem with overdosing and creating a residue that we're not being careful to keep until that residue expires, especially because once you overdose, the residue that's on the bottle isn't really an acceptable residue. The withdrawal, is not an acceptable withdrawal if the animal gets a large overdose or even a small overdose. I think figuring out ways or consideration of accuracy is very important, and it's important to remember that accuracy depends at least on three things. The gun has to work well, and these dart guns that we have available today require a lot of setup in order to get them to function appropriately. You have to know the distance to the animal in order to put enough pressure behind the dart to make sure it gets there at a velocity that's adequate to trigger the injection, but not so intense that it actually buries the dart in the animal or creates undue tissue damage. And most people are probably not going to be out there with a rangefinder, although if you're going to use a dart, I would highly recommend it. They're relatively inexpensive and they give you an accurate range to your target. They're going to depend on operator skill, which involves a lot of practice. So if you're going to use darts, you should be practicing to make sure you can get the dart where you expect it to go every time, and to make sure you can get those settings appropriate so that you don't overpower the dart, but you power it enough to make sure that it injects. And then animal compliance is a big issue. It's hard if you're in a position where you need to use a dart gun anyway. A lot of times those animals are already not standing still, but to make sure that you're disciplined about taking a shot you can make. I compare this a lot to hunting. Taking running shots with rifles at big game is relatively common and often ends up in a way that we don't like as much. And I think the same thing is true of darts. We want to make sure that if you're going to use a dart gun, that you allow the animal to stop moving and make sure that you take your shot when it's not moving. There's some issues with dart dysfunction that we probably can't control. A lot of it, I think, goes into the setup, but as you can see from those study results, they were at a known distance. They used the manufacturer's recommendations for the setup and still failed to have those darts discharge the medication a significant number of times. Slaughter withdrawal issues we've already covered quite a bit, and the dart recovery, I think, is really, really important. In my opinion, if you don't recover the dart, you can't know if you left part of the dart in the animal, and any animal that has pieces of injection material, needles, darts, whatever, in them is considered adulterated according to USDA specifications for meat, which means that if they have a needle in them that you can't recover, technically, and probably ethically, those animals should not go to slaughter. If you get the dart back and a piece of it's missing, you need to make sure it's not in the animal, because if it's in the animal, it might end up on somebody's plate, which is very, very bad for beef demand in the U.S. today. The other thing about dart recovery is that if you recover the dart, it makes sure that there's no environmental contamination, and it gives you the opportunity to assess whether or not the drug actually injected. And I think you always, if you're going to use dart guns, you got to have a backup plan. What are you going to do if this doesn't work the way we expect it to and the animal still requires treatment? So with that, I'll entertain some questions before we transition into a conversation about EQA. Somebody said, can you speak to the issue of compounding drugs and darts, such as when liquids are added to get the correct volume? So there's a lot of rules excuse me, about compounding drugs. Probably the most important rule is that the only individuals who are legally allowed to even consider compounding are veterinarians. It would be an off-label use of a drug, which by the letter of the law, non-veterinarians cannot do legally. And compounding comes with its own set of rules for veterinarians that are really important. We have to follow a pretty long list of rules about how we go about compounding. And one of the reasons that would be hard to justify is that it's medically necessary for the animal to compound to make sure we've got enough to make the dart work. There are lots of sizes of darts, and I think that's probably the best way if you're going to use them, is to make sure that you've got an array of darts available that you can get the correct dose in a full volume for the dart. Do you find cattle start to shy away from you if using darts a lot of the time? I don't use darts probably enough to answer that question personally, but I'll, for those of you who didn't see the webinar from 2 weeks ago, Dr. Dan Thompson made a couple of interesting comments about using darts in cattle, and his reference, if I'm not mistaken, was he was talking about we're kind of undomesticating our cattle. We tend to stay away from them. We don't handle them as much. And he made a kind of a humorous comment about how the pickup that shows up in the pasture without a bail on means somebody's going to get shot. And I think it would be illogical for us to think that if we use darts routinely, that cattle are going to start to find that disruptive and just steer clear of us whenever we enter a pasture if they get darted all the time. Do we have any, need to look at the...
Yeah, we got one in the chat box, Brian.
Okay. Can you read that one to me? On my chat box is
Yep. This is from Wendy, and she wants to know, what about using a tranquilizer and then treat the animal with the appropriate antibiotic in amount?
That's a good question. That's most of my experience with dart guns, is actually tranquilizing animals first. So we'll use a variety of products to do that. A couple of problems with that is that tranquilizers are off-label. There is no labeled tranquilizer for livestock, especially for cattle. And that means that that's off-label work, which necessitates that it needs to be done by or on the order of a veterinarian, which is possible. A veterinarian could prescribe a tranquilizer. The issue with that is the withdrawals, and another major issue is safety. So those are drugs that need to be very, very they need to be handled very cautiously because of the potential consequences to human health. Some of those drugs, or a lot of those drugs, are on the controlled drug schedule. So that means they have addictive potential. And because of that, they're very carefully monitored. That gets another agency involved. The department, the DEA, the Drug Enforcement Agency, basically requires healthcare providers to maintain careful inventories of controlled drugs. So my practice mentality has always been that controlled drugs only get administered by a veterinarian or maybe by a technician. They never walk out the door of a clinic. And there's some people that will fudge that rule a little bit, but it puts you in some legal jeopardy if you have those drugs and they're not appropriately documented. The idea of going to the trouble of tranquilizing and then treating, usually in my experience, I've saved that for things that require some sort of a procedure. Like we're gonna examine a foot carefully and then pare out an abscess or really identify the foot rot if it's there. To do the tranquilizer and then the treatment, I think we're putting the animal in more jeopardy if we already know it needs the treatment, because there are risks that go with the anesthetics as well. See, there's another question here. What's the ideal setting for using a dart gun? That's a good question too, and I'm going to dodge that one a little bit. In a feedlot, I'll be honest, I really struggle with justifying using a dart gun when we have handling facilities that are nearby and usually of very good quality. If there's really fractious animals, might be a discussion to have, and even then I'm not sure it's the best one. If we're threatening human health or safety because an animal is that fractious, I think there's other resolutions for that need to be considered. Big pastures, I got a little bit more, I feel a little bit more comfortable having the discussion, but still I think it needs to be considered carefully. Ornery cattle, frankly, in my experience, that's where we've used it, is animals that are out on pasture. They're either really sick or they're in places where they shouldn't be, like towns, and we need to get them taken care of quickly and to make sure that other people don't get hurt. There's a comment here. I like comments too on the Slido part. They definitely shy away if you need to get more than one dart in to treat an animal. So if you need to dart a bull 3 times to get the full dose, by number 2, he's probably not going to be sticking around anymore. He's going to be on his way somewhere. So good point. Any other questions? Anybody want to chime in? And oh, here's another one. Do you use a way to mark a sick animal so pen riders can treat it later? We've talked about that. I've never actually done it. Somebody else, if you've done it, feel free to comment. Typically, we rely on the identifications of those animals, whether it's a tag or a freeze brand or some individual ID, or they just get pulled right away so that people that are going to treat them later know that they're sick. We've talked about things like paintball guns and other types of devices that we could mark them remotely, so to speak. And while that may be convenient for the people, I expect that it's probably going to be kind of hard on the mentality of the cattle. And again, I think if we're talking about stress, we want to make sure we do what we can to minimize it. And I can't imagine getting smacked with a paintball would be low stress for an animal in a pen. But imagine might be the right word there. I'm speculating. Any other questions? Otherwise, I'm gonna make a transition here, and we're gonna talk a little bit about beef quality assurance. And I have a couple people that are gonna join me. So if Becky and Jesse could unmute and get ready, maybe turn your videos on. Hopefully we can take that much. We're going to transition. The use of dart guns brings up a good discussion area about BQA, and I already told you that dart guns are not in compliance with any kind of BQA guidelines. So in the interest of trying to convey the importance of staying in compliance, I've got a couple people that know a lot about BQA and are going to help. I hope Jesse's on.
Yeah, Brian, I'm here.
He's going to be called Brian because I shared my link with him. Sorry about that, Jesse. So I got 2 people on. So there we go. Becky Funk and Jesse Fulton are going to join me, and I got a few questions for them, and they're going to provide us with some insights on BQA. But just by way of introduction, so Becky Funk is a veterinarian here at Great Plains Veterinary Educational Center as well. She works out here with me and the other vets that are out here. She comes to us by way of practice. She was in practice in Northwest Nebraska up in the Panhandle for quite a few years, and she got her her veterinary degree and a master's degree from Kansas State University. And then Jesse is someone we're really excited to introduce. So Jesse currently is the director of producer education at BQA, but he is on his way to Nebraska. He took the role of BQA coordinator for Nebraska, and he'll be starting later this fall, and we're really excited to have him get here. And Becky, who is serving in that role right now, and I and several other people are really excited to work with Jesse to advance BQA here in Nebraska. So with that, I got a couple questions for you guys. Let me pull them up. I had to rehearse to make sure I got my questions right. So the first question, and maybe both of you can take a shot at this one, is why does BQA exist?
Want me to go? I'll go.
Do I need to
first.
flip a coin to decide who goes first?
I can go first. It's fine. So why BQA exists? You know, BQA actually came about back in the 80s, and it was after cattlemen became concerned about governmental regulation due to the number of volatile residues that were actually being found in beef packing plants. So to try to prevent the government from stepping in, a group of cattle producers started working with USDA FSIS to develop some pre-harvest safety production programs that assessed residue risks. And that actually became the backbone of what BQA is today. Now, BQA is expanded, on other areas. They focus on not just volatile residues. So the program is ever evolving. As you can see, if you just read through the manual and everything that's covered in it, but that's kind of where it all stems from.
Becky, any other thoughts to add?
No, he covered it very well. That's kind of my spiel as well.
Cool. Becky, as a veterinarian, how have you integrated BQA into your work, and why did you feel that was important?
Yeah, so as far as my practice life, BQA is one of those things that just initiates a lot of good conversations. I mean, you touched on several of them today. When we talk about drug selection, drug dosage and administration, things like that. But as it has expanded over the last several years, it's now also leading to conversations about stockmanship and husbandry, animal welfare, sustainability, all of those things that we can touch on in those conversations with clients that can open the door. The other thing I think is really important for practitioners as young practitioners or new graduates, it's a skill that you can have day one. You can walk into a practice or start a practice and have the ability to offer BQA certification to your producers, and it's something very easy to offer right from the start.
Jesse, you've been working in BQA training across the country, and you've had a lot of experiences. Can you give some examples of how BQA has been integrated into beef operations that have a direct benefit to the producer? We often think about BQA as being something we do for somebody else, right? We're trying to protect the safety of the consumer's food supply and the reputation of our production systems, but are there things that you can think of that are directly beneficial to producers relative to BQA?
Yeah, for sure. One of the main pillars I want to talk about BQA is record keeping. Record keeping is actually one of those areas that many producers still struggle with, in that they might write it down, they'll write it down on a napkin, but if they lose that napkin, then they've lost that record of that animal. And so why is record keeping so important is because not only can they record how often they're treating certain animals and making sure those animals cleared that withdrawal period, but also it tells them which animals are performing better than the others. And if they're able to cull out those non-performing animals, it can make their herd more profitable. A couple other areas, healthy animals are more productive. and they have better gains. And then BQA also focuses on handling, kind of what Becky was talking about, and that, you know, if we handle those animals in a low stress manner, they're less prone to be stressed out and have increase in shrink loss. And then cattle under higher stress tend to go off feed, and then they're burning energy that they'd be using to put towards gains. So, you know, when we follow BQA and those main pillars that I mentioned, you know, we're ensuring that we have healthier animals that are going to perform better for us.
Cool. I've always discovered that when we effectively implement low stress handling, that families can actually talk to each other the night after a processing event. And that's good because we save money on counseling and lots of other problems if we can do that. So it's true of my family for sure. Yeah. Becky, do you have anything in that area you'd like to add?
No, I think that covers that very well. Yeah.
So this question is for either one of you as well. Is what do you think what's the value of BQA down the supply chain? And especially thinking about the consumer, how does this help us get more value for our product?
Becky, I'll let you take that one first.
All right. I mean, from my perspective, you know, when I talk about the veterinary side and the health side, a lot of what I look at is protecting that consumer perception. It's in that welfare realm that we can document that we are doing the things we say we are doing, whether it be animal welfare, antibiotic safeguarding, you know, for human health, things like that, that consumers want and demand and are not going away.
Yeah, I definitely agree. You know, I'm gonna back up a little bit to the producer and even the chain of how it gets, you know, to the plate essentially. So if we have a producer, beef and dairy, you know, dairy is part of this. About 24% of our beef, you know, out there is from dairy herds as well. So beef and dairy producers, livestock auction markets, even our truckers, following beef quality assurance transportation practices. You know, if we get them to follow a lot of those practices, then we'll see, you know, less bruising. You know, in 2016, the National Beef Quality Audit showed us that we were losing $62 million a year just on bruising. And that's something we can fix based on cattle handling or redesigning our facilities. You know, a lot of trucking companies are actually redesigning their trailers to try to allow more space as cattle go down to the belly of a trailer so they don't bruise their backs. We'll see a lot less injection site lesions that will, you know, we still tend to see in plants today from where injections are not given up in that neck region. They're still given in the round or even along the top line that we see. And then a reduction in foreign material that's still showing up in plants. You know, we still have an issue with foreign material, and we just need to keep working and educating our producers out there. You know, this product does end up on someone's plate, and we need to make sure other things that shouldn't be there end up on someone else's plate. As for the consumer, you know, more and more consumers are wanting to know how their food is being raised. And so BQA tells that story. And so when a producer is involved in BQA, you know, they can fall back on that as their story. This is how I raise my animal. You know, the National BQA program has done some market research introducing BQA and the practices to consumers, and they like the program, and it gives them confidence in the protein source that they are purchasing from their grocery store.
Cool. So now is your opportunity to speculate just a little bit, and I'd like both of you to take a crack at this one. So get out your crystal ball and give us an idea of what you think there's some what might be coming down the pipe that, as it relates to BQA, that producers should probably know about, and things that are going to happen in beef production that BQA can help them address as they come. So not necessarily just BQA stuff, but just things that are coming into our cattle business. One thing, if somebody wants to take a shot at it, is traceability. That's a hot button topic. It continues to be a thing. So I just showed you my crystal ball a little bit. I shouldn't have done that.
Well, in my crystal ball, the one word I have to say is audits or verification programs. They are coming. That's something we're going to be seeing a lot more of. We're already seeing those things at the feed yard level. Many feed yards are having to participate in something like that. And these audits and verification programs really just focus on proper animal care handling and record keeping. And all those things, again, like I've mentioned, throughout this is all covered by BQA. Now, there's been a little bit of talk about those audits or verification being at the cow-calf level. Now, that's way down the line. They'll still have to get it figured out at the feed yard level first. But we know if they're already talking about the feed yard level, then I'll just leave it at that. So, if you're a producer that's already participating in BQA, you can utilize the BQA feed yard assessment and cow-calf assessment, and those will help you better prepare for things like that and what type of records you should be keeping and what you should really be looking for when you work your cattle on certain observations that are usually made in these animal verification programs to ensure that you would pass something like that.
Becky?
Yeah, so my crystal ball, I guess, especially with the conversation we've had today, pharmaceutical use in food animals is not going to get any easier in the future. We saw the VFD go under implementation. Everybody was fairly concerned about that, and it's been implemented and is functioning relatively well. There are other things in the pipeline that are coming. Some of our over-the-counter medications may no longer be available over-the-counter in the next few years. So I guess I would say that VCPR, that veterinary client-patient relationship that is discussed in beef quality assurance, is going to become critically important, more so even than it is now in the next several years. Because it's not going to get any easier to treat these animals or to do preventative care without that veterinary involvement.
Any other comments you guys would like to make? That's it for my questions. I shouldn't have used my crystal ball at all, Jesse, because it's broken. It doesn't work at all.
No, I think you were right, though, on the traceability. I will revisit that a little bit. That's something that's going to keep coming. Full traceability, we already see that in the state of Michigan, right? They already have a full traceability program up there. And so, we've heard cattle trace is, that got introduced into the new long-range plan. Talking about it more at the cattle industry summer business meeting this year. So it's going to be really interesting on where we go with traceability. I kind of believe in it, and that it'll help us when we try to trace back a sickness. Foot and mouth disease is something we should really start taking very seriously here in the U.S. and paying attention to our biosecurity practices that we practice on operations across the U.S. Another thing is, one thing I mentioned, foreign material showing up in the plants. The plants want to find out who's sending cattle that have bird shot in them, and so that's that. They're going to figure out a way how to figure that out. So traceability is one of those things.
Well, if anybody has questions for either Becky or Jesse or for me, we'd sure be happy to entertain those. Thank you both for participating.